Reason for high drug prices in the U.S. Over 50% of the class knows someone with a chronic disease and takes medication regularly. If you are the other half, I hope it stays that way for you. $84,584 for 90 days of medicine is the combined price we paid for our daughter's medicine with cystic fibrosis. 2 of these are specialty medications, so they are priced higher. It is medicine that not only improves her life, but will also extend it. I am willing to pay a higher price for medicine, but there is no way we could afford a 3-month supply. With insurance, copay assistance from the drug companies, we are fortunate this is not the amount of out-of-pocket that we pay, and we do have money left over to eat. When researching this topic, I used the Wall Street Journal, Food and Drug Administration, the U.S. Department of Health and Human Services, and the U.S. Journal of Health and Law Care. I had a preconceived idea already formed, but quickly found out that there is not just a single answer, like the pharmaceutical companies are lining their pockets or that the government was not doing anything to control these prices. Pharmaceutical companies, generic fees, and government are part of the reason the U.S. pays more for medication. To begin, pharmaceutical manufacturers develop life-saving drugs. Drugs are the most significant reasons for the unprecedented gains against deadly and debilitating diseases. Therefore, when pharmaceutical companies come up with a price, there are several factors that are taken in consideration. The article at State and Federal Policy Solutions to Rising Prescription Drug Prices in the U.S., published in the Journal of Healthcare and Law Policy, states that drug prices consist of investment in research and development, marketing, profit sharing, charitable contributions, and there's a cost component used to reinvest in the future innovations with the manufacturer. It is true that the Americans pay more, but in return we get early access to life-saving medications. According to the Wall Street Journal, How to Reduce Prescription Drug Prices, First Do No Harm, produced in 1995 to 2005, 12 new cancer drugs were introduced in the U.S. compared to 13 in Canada, France, Germany, Japan, Switzerland, and UK combined. To continue, we'll look at generic drug prices. Even though they are cheaper than brand drugs, they too can be more expensive than the US. Most new drugs have a patent exclusivity rights on them. A patent is granted by the Patent and Trademark Office anywhere along the development of the new drug and can encompass a wide range of claims. The Food and Drug Administration approves market exclusive rights and is granted to a new drug application if the requirements are met. Patents can last 20 years from the date of filing, while exclusivity rights is granted on the type of drug. Due to these patents and rights, they have the market on these drugs. According to previously mentioned article in the Journal of Healthcare Law, the Hatch-Waxman Act of 1984 was introduced. It outlines the process a company follows in order to be able to make a generic drug. Thanks to this act, it was introduced an estimated $1 trillion in savings over the past decade alone, the availability of low generic drugs. The Generic User Fee Act of 2012's purpose was to speed the access to safe and effective drugs to the public and reduce costs of the industry. Any firm manufacturing human generic drugs must pay a FDA user fee. This fee is to increase the ability of the administration to perform critical program functions and to reduce costs considering the timelines reduced. The fees then become part of the price of the drug. The FDA, according to the Health and Human Service website, approved a record number of drugs in 2018. Finally, I will discuss the government's part. Even though the government enacted the Hatch-Waxman Act and the Generic Drugs User Fee to make the generic drugs available to consumers, there are areas that still need improvement. There is a gag order on pharmacists to not disclose the actual price of the drug, so even though the drug may be cheaper than the copay, the consumer will pay the copay price. This is in part to the pharmacy benefits managers, the PBMs. They are the middlemen that control the formularies, the list of drugs covered by a plan, and rebate from the drug companies to the PBMs or payment for influence. The article from the Journal of Healthcare Law and Policy discusses several state and federal laws in place to protect the consumer. Some states have had success against price gouging protection laws. Others have passed transparency billings, and manufacturers explain what components go into the price of a drug and help understand where prices might be manipulated by the other stakeholders in a series of transactions between the manufacturer and consumer. The U.S. pays almost twice as much as our peer countries do for the costliest physician-administrated drugs in the Medicare, and this is because there is no negotiation and often little competition. The U.S. is also the only Western country that does not use price regulation at the onset on the national level. Alex Azar, the Secretary of the Department of Health and Human Services, says that in 2018, the Trump administration signed into legislation a ban on gag clauses and proposed introductions of foreign valuations on drug prices known as external reference pricing on drugs administered by the U.S. doctors, Medicare B. Azar and President came up with a blueprint for fundamental changes to lower prices, and when released in May 2018, drug companies took 57% fewer price increase on brand drugs. In concluding that the drug prices are based on drug companies, generic competition, and government, there are beneficial and not beneficial reasons why the U.S. pays more for prescription medication. The next time you take your prescription medication, you will have a little better understanding of what went into the price you just paid.